Good afternoon and welcome to United TV. My name is Kamal Arkan. Today is June 7th, 2024. Another political series episode that we are going through today. We are going to go through. Our guest is Marcus Henry, who is running for Newcastle County Executives. He's going to join me in a second. Marcus, how are you doing?
Good. How are you, sir? Happy Friday.
Happy Friday. So, born and raised in Newcastle County, went to St. Francis, St. Mark High School, then Howard University, later at UD, you got your MBA or your master's in public administration. So now you're running for the Newcastle County executive spot. So our goal is to get to know you. This is more about you than it's for us. So we would like to know on the personal side who you are, what you want other people to know about you, and then we'll get into the specific questions after that.
Well, thank you for this opportunity to speak with you and to your audience about our campaign and a little bit about my background. I'm born and raised in Wilmington, Delaware, as you indicated, Newcastle County. I come from a family of, I'll call civic servants to people in the public. My mother, Margaret Rose Henry, was a longtime state senator here, servicing Wilmington for over 25 years. And growing up, she instilled in my brother John and I the importance of civic service and giving back. And I've carried that all through my career, both professionally and other endeavors that I've done over the years. So over the last 25 plus years, I've worked in state and local government here locally. I've worked in state government with the Delaware State Housing Authority. I worked at DENREC, the Department of Natural Resources, Environmental Control. I also worked in the private sector. I worked in real estate development and finance, focused on affordable housing here regionally in Delaware, Maryland, and New Jersey. Also served in the Wilmington Housing Authority as their director of development. And then I joined Newcastle County and served for over 11 years in 3 different administrations under county executives Paul Clark, Tom Gordon, and for the last 5 years, Matt Meyer. I left Matt's administration 2 years ago to run for this office. Most of my time and tenure was spent running the Department of Community Services, which was oversight of federal community development and housing programs, library administration, youth, family, and senior services. I also for a time served as the Economic Development Director for Newcastle County. I'm also happy to say that I'm also a business owner here in Delaware with my wife. We actually have a healthcare company in Delaware where we provide clinical support services for children with autism. I started that about 10 years ago because my son was diagnosed with autism, and we were frustrated at that time for the lack of services at that time that were available to service my son, Alexander. And we started this clinical support service. It's now called Bright Bloom Centers 10 years ago. And now we're one of the largest providers in the state of Delaware. We have 3 healthcare centers in Delaware alone, in Wilmington, Middletown, and Milford. We're also in South Jersey, in Logan Township, Swedesboro, and soon we'll open up a practice in Elkton, Maryland, and later this year in Seaford, Delaware. I mention all this because I have private sector experience, public sector experience. I know how to get things done. I know how to run large government agencies. And just for some background on, would you like to stop there? Forgive me.
No, those are all important. So the position itself is an important one. So Newcastle County is the biggest of the 3 counties in Delaware with the most population, with the biggest cities like Wilmington. Chris Coons actually was a Newcastle County executive before he became the he became senator for the U.S. Senate. So this is an extremely important position, and the person who's right now in the seat is running for the governor's race. So I should mention this. So you and we didn't meet before. At least I don't remember if we met. So we spoke once before this event. I'm sure we maybe saw each other.
I know we have, yes, sir. You're very famous locally. You're very famous.
Well, but I met your mom. I didn't actually go and introduce myself, but she was at the event for the for Bethany Hall Long's panel on Tuesday night. So it's kind of like it's a nice coincidence that I didn't actually until just today I did not know that you were actually her son. So having a really famous, legendary mom like Margaret Rose Henry, um, it brings, I guess, certain responsibilities to you. Is that helping you or is that hurting you? How do you actually process that for this race?
An excellent question. I think 98% it certainly does help me. Although I'm not new to government, I'm new to running for elected office. And so just by extension of being the son of Margaret Rose Henry, it certainly helps me to an extent with name recognition, but also potentially opening up some doors to people to get to know who I am. But having said that, this is a very large office, even larger than the state Senate office. As you just alluded to, Newcastle County, we're over 580,000 some population. And the government's responsible for very important initiatives: land use, water sewer infrastructure, public safety, policing, all these things in unincorporated Newcastle County. So being the son of Margaret Rose Henry holds me to a standard, right?
Mhm.
But also it makes me have to work twice as hard to prove myself to others that I have what it takes for this office. And I feel very confident in that, thanks to her and the heck of a lot of support that I've gotten over the last couple of years.
Sure. She's a wonderful lady, very well established. I think she's one of the most successful state officials with number of terms that she did. That's amazing, and I'm sure that's going to help you. Not necessarily, you know, what you need to do for the election itself, but what she contributed to your life all this time. Probably that's the biggest help that you are going to see. I don't know if she's campaigning for you though. Is she campaigning for you? Like, are you guys?
For me.
No.
She's my biggest champion and advisor. Yes.
Good, good. So, well, that's in that case, you have to take advantage of that. Now, I do want to talk about the Bright Bloom Center a little bit. Uh, the job that you are running for, the position that you are running for, just like the governor's position or, well, governors and I think the Newcastle County executives, mayors, those jobs, I see them as like more like a CEO positions
Mhm.
for the state or the county or for the city. And having certain experience definitely is going to help from the business side. So someone who's going into those with no executive experience, that's a struggle that they are going to have, and then they're going to most likely learn that on our expense. So you having your own business, but it's having a business that's kind of like sensitive in a way that it's not just selling XYZ, but it's a service in healthcare for a population that needs a specific special attention, and that's been almost 10 years now, right? So. I want to talk about that a little bit. So, how are you guys helping? What does the company do, and how many maybe lives that you guys are able to reach out from that program, just to get a little bit better understanding of what you do today.
So, and just to be clear, my wife is the CAO of the company. She's been running it for half a decade now. I support her, just the startup and just to keep things moving along. So the credit goes to my wife and our successful team and the growth we've had in our company. But you said that, I mean, to run a business we have over 100 employees right now, and we service over 120 kids every single week statewide. We also operate in some of the school districts doing paraprofessional support services. But the core of our business is applied behavior analysis therapy for children that have on the autism spectrum disorder. That's the core. We also contract, I should say, with doctors with diagnosis for autism, which is critically important, the medical diagnosis of autism spectrum disorder.
Mm-hmm.
There's a lot of other providers like us, but not a lot in Delaware specific to a center-based model of service for these kids. In other words, the parents drop the kids off and the kids get direct therapy for several hours at our centers versus just going into the homes of these parents. We do that too, but we believe strongly in a center-based model in providing our service delivery. It's been very successful. I think we've helped over 1,000 kids over the last 10 years. We currently service about over 100 right now. And one thing I'm sure you're aware, the medical industry is always changing. Regulations are always changing. A lot of our kids receive their insurance reimbursement through Medicaid, right? And so we're always up to date with respect to Medicaid requirements and those authorizations. We operate in different markets in terms of private insurance and their requirements. So
Sure.
the business is really getting paid by health insurance insurance. That's the business. But the outcome is successful with these therapies for these kids. I'm very proud of the work my wife and her team has done.
So I'm sure that's going to help you a lot. But what I also see is that's going to help, if you are elected, help you on the healthcare related issues. So better understanding the system, certain issues day to day, what healthcare providers are dealing with. Now, not only from the healthcare as an expense item on your budget for the Newcastle County, but also Newcastle County is one of the biggest employers in the state of Delaware. So it's a self-funded program, right? Self-funded employer. So that's kind of like from both angles that you have to kind of really have a good understanding of healthcare. Recently, we have a lot of discussions around the House Bill 350. And it's going through some modifications. I put my public support for it, although I always say this, I work with Bethany Hall Long on her campaign directly, and also with Sarah McBride. But I'm still, I'm not a big fan of big governments. But it is needed when the government actually is involved, especially with the nonprofits and other types of organizations, if they are receiving resources from the government. And I think the HB 350 is an important bill from that point. And I believe Speaker Valerie Longhurst is going to be with us next Friday. So it's not 100% confirmed yet because I think she's going through a lot of different meetings and like busy right before the break. So, but so far we are on the, she's on our book for next week. So we are going to kind of open up this, and then we want also her to explain why this is important and why she did it. But it gets also a lot of reaction. Like I posted stuff on my LinkedIn, I get direct public comments from the board members from Christiana, which are not really, they're not really at the sophistication level of the messages are low. I'll just say it in that way. And then we go with the factual things like the executive at Christiana receives 70% increase in 2 years, while I didn't receive a 70% increase on my income. And Sean, who's here right now, I think he would be very happy if he receives a 70% increase in 2 years.
I wouldn't argue.
Right?
I'm rooting for you, Sean. I'm rooting for you.
Thank you. Appreciate it.
So, but this is happening, and it's happening under the non-profit titles. And I just want to see, wanted to know what your position is on the HB 350 and how is it affecting, how would this affect Newcastle County from your leadership standpoint?
Thank you. I may not give the most satisfying answer on this because I am a very diligent researcher and studier of these things. And honestly, I don't like to comment on legislation until I see close to the final version, as you can understand that. You said it earlier, and it kind of rings in me. People are hesitant about big government, right? And I feel the same way, even though I've worked in government most of my career. I think government has a specific role in terms of regulation and enforcement and laws, what have you. But when we get into the regulation of the private sector and how they're managed, even though there's public subsidies or dollars involved, I think we need to be very, very careful in terms of what the mission is and the objective and how we can overall affect the marketplace in terms of these things. Having said that, there's certainly a need, I think, with the real foundation of the legislation in terms of regulation and oversight. But I think we just need to be very careful and stipulate carefully what that looks like, how it's regulated, and who those folks and agencies are that regulate those things. So I'm going to be non-committal on that. I appreciate the intent of it, but I really would like to see more details on that. As a healthcare business owner, I have to study these things all the time, not just with this legislation, but when things pop up, we have a team of attorneys and advisors so that we're educated in terms of what our position needs to be and how it could potentially affect our bottom line. So I hope that's a good answer to what you're asking.
No, it is. I mean, again, the issue is how much we want government in our businesses. But the interesting part with the healthcare under the again nonprofit organizations, the Christiana Hospital's last 5 fiscal year net income is $1 billion. So that's actually 1,014,000,000.
They have good margins too. Yeah.
So this is nonprofit, right? So 1 billion is like. I always tell Sean, I'm like, if we made that much, I probably would have this YouTube in a different setting, has a lot of money. So, but then 1 year after the pandemic, it was 357 million. So, and that's the year that they receive a lot of government funds. So they need to be accountable. So that's the position that I'm taking, because I also, from the ambulatory practices standpoint, outpatient, primary care, pediatric, all the different specialties. We have about 22 of them. We are #1 bariatric surgery program with our surgery center, American Surgery Center, opening up our second one, and they're both in Newcastle County, so you can get credit for those. But what we see is we don't have those high reimbursements, and therefore we don't actually necessarily benefit from the setting that hospitals have, and the labs and the pharmacies. And there has to be a kind of a good control, and the expenditure, the benchmarking for the expenditure didn't work. So it's just like, if you don't have the transparency with how they do certain things, then it feels like government has no choice but just bring more layers into what they are doing, just so that they can maybe make it work this time. I mean, that's just my position. So it's a tough one. I'll give you an example. We are about to get a client, and it's a community hospital, and they bleed money, they are bleeding. They lose so much, and they need help from us on the revenue cycle management side. And I'm like, how is this possible when we have these, the Bay Health's making 450 million in 5 fiscal years? How is this possible at this hospital? I won't mention where they are. They're losing money. So there must be something wrong, right? So that's why it's a discussion that we must have in the state of Delaware, especially when the state budget is 1/3 of the state budget is on the health and social services. So now, from the Newcastle County executive position, #1 issue when you take the office, what's the #1 issue that you are going to actually aim at, target?
I'll say there's multiple issues, 3 or 4 big ones, but I can't say the top one. Almost tied is, well, always with government, it's public safety, right? And it's how we manage and operate public safety function. For Newcastle County, that's policing, 911, paramedic operations. These are critical core service functions that the county services, other jurisdictions in collaboration with Wilmington, Newark, and others. We need to make sure that we've created a proper funding and job opportunities and a flow of job opportunities in these areas to ensure these public safety parameters for Newcastle County. That's always the most critical thing. We have to keep people safe and have these services available. I want to make sure we're well funded, that we've done a deeper analysis in terms of the market with respect to what the job classifications are, the pay scale benefits, and to make sure we're looking and forecasting our employment structure to make sure we have a flow of new people coming into these service areas. That's probably #1, I have to say. #2, and a close number, almost 1A, I would say, I think a major issue facing Newcastle County and the state is what I say it's called housing affordability. We have a huge housing affordability issue here in Newcastle County specifically. That includes a subset of obviously need for affordable housing, but I'm saying it broadly, also inclusive of housing available at various price points and housing types that we just don't have on the market to service the population we have right now, and as it projects into future population growth. So I think Newcastle County, working with state government and the private sector, need to look at ways we can incentivize not just new construction of single family, but look at multifamily, look at infill redevelopment, even potentially looking at commercial vacant properties, repositioning that for other types of use that may include housing. I say that because everybody I talk to on the campaign trail, and I've talked to a lot of people, it comes up time and time again, where folks were worried about just a subset of affordable housing. They're saying my son and daughter just out of grad school, making a decent living, can't find a house to buy, can't find an affordable apartment. And to me, that there's something wrong in the market. And I don't think it's just a function of current market conditions of volatility in interest rates and these things, and or COVID for that matter. I think that the county historically, by our land use policies, has perhaps hindered development happening over the last year. So now we can't meet this demand and population growth. Not just a county problem, but a state problem as well. And I think county government, with control of land use and what we do, can be proactive in assisting in these areas.
So I have one question that's kind of like maybe it will help others to better understand. Now, I live in Wilmington, not in the city limits, but right outside of the city limits. Like city limits in terms of, where you pay the
municipal boundaries.
payroll tax, the extra payroll tax. I'm right outside of that.
So am I, by the way, yes.
So I think we're close, right? Like where we live.
Close, yeah.
Now, we have the city as the mayor is running the city, but then that city is in the Newcastle County, and then there is the governor. So these three different positions, are there some overlapping in between who's responsible to what, or are there some kind of like fine lines between the responsibilities of each different positions? Like if we have a problem, for example, in this, let's say 19806 or 19805, 19803, 19807, one of those zip codes, do we call this the mayor, or do we call the Newcastle County executive, or do we call the governor?
So what areas you talk about is within the city boundaries, okay? So you call city police, for example. So when I talked about policing earlier in public safety, that's unincorporated Newcastle County with respect to policing, right? Wilmington has its own police force. Newark has its own police force. Most municipalities have their own police force. There is coordination on efforts with respect to crime prevention, between the city and the county, but that's mostly a municipal function. Housing programs, initiatives, better federal programs or funding that comes through goes by jurisdiction. City of Wilmington's its own jurisdiction. Newcastle County is its own jurisdiction for federal housing programs. But in these initiatives that I talk about of initiating housing, increased housing opportunities, economic development things, for example, which we haven't talked about, I believe these things can be coordinated among the various jurisdictions, Newcastle County, the state, Wilmington, Newark. Because to me, it's like if we can draw new business or help business retention, I want it in Newcastle County, but I also still want it in the state of Delaware. Or if it helps Wilmington, it helps Newcastle County and vice versa. But we're a small state, and I think we need to work a little bit better together from a governance standpoint on some of these initiatives. But to answer your question, every municipality or local government has its own jurisdictional control of these things.
So I'm going to take my question to a more specific situation. So recently we just got a new office in downtown Wilmington.
Yes.
It's a primary care and some of the other subspecialists with us, pulmonary, bariatrician, bariatric surgery, cardiology. This is the 600 Delaware Avenue. So that little island, you probably are very familiar with.
A lot of times, yes.
Yeah. Well, now like we have our obnoxious pictures and signs on it, so everyone knows. So the problem is when I bought that property, the issue for me is, can we actually safely bring our patients here so they can park in the across the street, they can go through and then come to the office. I say safely because in the inner city there are different issues that we have to deal with, and because it's kind of right in the center, it's kind of funny. Like it's not the biggest or the best building in the city of Wilmington, but it's right in the center. So When we have issues with our surroundings, if there are like, I see some people that are at the red light waiting for, asking for money. Some other situations, some people are pausing there for a while. So is that the city responsible?
City of Wilmington. Yes, that's the city of Wilmington. Yes, fully.
But
Yeah.
when do we call you then? If the city of Wilmington doesn't take care of it?
I'll give you a list of other ways to call me, but that's why we have these local governments, right? But actually, in all seriousness, whoever the mayor of Wilmington is, and I have my favorites, but whoever the mayor of Wilmington is, it's critically important to me that I work closely with him or her when they're in office, because, and I'll say this very clearly, the health of the city of Wilmington, be it crime or these issues that we're talking about, affects the entire health of the state of Delaware. It is not mutually exclusive. So Newcastle County, the state of Delaware, we need to assist the city where appropriate for these type of measures to help, be it quality of life, crime,
Right.
what have you. But the city is ultimately responsible for its own crime protection and public safety, and in areas that you're talking about.
So you said you have a favorite for the upcoming mayor?
I'm not. Nope.
So you don't.
No, I cannot.
I know
I do that right now.
John Dunn is running for that now. That's kind of interesting, though, isn't it?
It is interesting. Yeah, the only time I heard of that was years ago. I think it was Mayor Schaefer from Maryland, the
Okay.
mayor, and then he was governor, and then he went back to being mayor. But I think very, very highly of Governor Carney and all the work that he's done, and I'll leave it at that.
Well, but also because the city of Wilmington also is very important. So I guess
Critically important.
for someone like John Carney to, I mean, he wasn't, really, he didn't want that. Otherwise, like, he could stay as, like, he could just run for several different positions and he would win most likely. But this is kind of like, I think he wants to serve. I worked with him in different things, different projects, and it's kind of, I think it's going to be okay for what he's doing. Although a lot of the first question is always like the governor's running for the mayor, but that's not the case for Wilmington. Wilmington is extremely important, as you said earlier. Now, the community development and economic development, they kind of go hand in hand. So after pandemic, things are very different. Things are expensive. Now we have inflation in this country, which we never had in our lifetime. So how do you think that's going to be handled under your leadership? Do you see challenges on those issues, and how are you going to tackle those problems?
Very, very deliberately. I think it's so critically important that the county, which does a very good job as a state in terms of our economic forecasting, that we drill down on that even more, because to your point, there's still so much unknown in terms of the inflation, where it's at right now, and what the expectation of when it's going to low, but also just as that juxtaposed with job growth here in the state in Newcastle County. And our revenue projections, what it looks like, both from the county and the state. The county's a little different. We have three main sources of revenue, property taxes, permitting. We get a portion of what's called realty transfer tax that funds a lot of our operations of our government. It's a percentage of that. And that's always a volatile number year to year. Most that's based on housing purchases or commercial development or business coming into Newcastle County. We get a percentage of that tax. So I have careful financial folks in my finance department, myself, being very diligent managing the affairs of county government. But also, and you mentioned this, with all the federal pass-through dollars that have come over the last few years because of COVID that Newcastle County received, the state, we're coming out of that now. And those obligations are going to end soon. And so we really don't have the clear economic picture of cost of government services in the near future, right? But also looking growth projections about how we're going to, these demands are to come on. And I think people, unfortunately, some subsectors of people have gotten comfortable a bit with some of the subsidy that they've received, and that's run out. What's that look like when it starts to affect, when you're seeing it now, I think the indicators with the job market. And so we have to have a vibrant job market here in Newcastle County. I think the county has to incentivize that too with the state. And part of that's job growth, housing affordability. They go hand in hand. And so working the initiatives that I want to work in conjunction with economic development, job opportunity is critically important.
No, I follow you on that. So now with the education system, and you have two kids, what's the county's responsibility in terms of the education and the policies in education, and how we can actually improve the education system in the state of Delaware and in Newcastle County? What are the responsibilities of the county specific?
So this is interesting. The county, Newcastle County, has no direct administrative authority over the educational system in Delaware or with the school districts, okay? Although we do collect the taxes on behalf of the state and the school districts from county residents, okay? So we're the tax collector for you guys, and we give that to the state for their distributions. Having said that, however, the previous administration, Matt Myers' administration, and others have made it a point, and I will, of supporting educational opportunities that help supplement and assist local school districts with programs and services. We've had a number of literacy programs in our libraries, joint efforts with the school districts. I want to create more opportunities like that. But I think, unfortunately, there's systemic issues in our public school system that need to have broad changes that's instituted from the governor and others, because I think that's the one thing holding us back here in Delaware. We have great public schools, by the way. We do. The problem is that there's the consistency of that, and just to make sure there's equity, I think, across the board in the various school districts in terms of funding and resources in these various school districts. So I think we need to take a broad look, the state and the governor. I want to be at that table, hopefully as Newcastle County executive, to advocate how can we improve the service delivery, how can we fund teachers, and how can we support these things. And I think you have to look at the financing of it too, in terms of the referendum process of how they fund capital outlays in the future. And I don't think it's being very effective, quite frankly. I don't think it should go to public every few years for this type of initiative. I think there should be another way to create these funding initiatives for school districts.
And I think there are some improvements that county administration has done for the teachers' salaries just I believe in the fiscal year 2024. I don't have the specifics in front of me, but I know Governor talked about that when he was with us 2 months ago. Now, well, the education system is not so great yet, but I think it's maybe on the right direction, I would probably say. Now, I don't have kids, so it's easier for me to say. And honestly, just for someone who understands the settings of the state, unless we increase the real estate taxes, public school system is not going to be at the level that we want, because as we know, we are bordering with Pennsylvania, and just same house is paying twice more taxes, and they have better school systems, right? So this is kind of I think people really need to see this as give and take. Are they willing to pay more, or are they willing to actually send the kids to private school? Now, if I had kids, I would probably send them to private school, unfortunately. But I know some of my physicians who live in PA, they do send the kids to public schools. So it's kind of you have to, I guess people have to see this whole picture rather than just one. Because we won't just get it unless we pay for it. I think that's when
how we pay for it. I think we're still at the top 10 per pupil expenditure rate about what the spend is for these kids, but it's not hitting the classroom necessarily, or it's not hitting the teach. There's something not quite working consistently across the board, right? We haven't figured that out. So I think it's always additional funds, but I think it's a process too. I think we need a closer just examination of how we're funded, how we're operated at the various school district level, and there has to be ways to improve that service delivery for what we do. There just has to be.
So, I always tell our political guests, from my background, I'm 50 years old, so 25 of those were in Turkey. I was born and raised in Turkey. And the last 25 years, I've been in the United States, but I've been actually in Newcastle County. So I call myself a Delawarean. just because this is where I choose to live, and I didn't leave the place for 25 years. But there are young people who are just finishing colleges, like people like Sean. He's from upstate New York. His family's there. He finished UD and he played football for UD. Did two majors, double major, and joined us in the last 2 years. He's with
Go
us.
Blue Hens. Go Blue Hens.
There you go, roll hands.
So we want to be able to keep younger generation who may not have family ties in Delaware and in Newcastle County. And I don't know if you were able to catch, but we had Rob Buccini about 2 months ago, and we discussed their projects and what they do for the city of Wilmington. There's so much commitment from the business
Absolutely.
Standpoint. From personally, I think they devote a lot of their resources to the city. So how do we keep them? And I want to give you just one other thing that's is my own personal experience just lately. After maybe 2 or 3 years, I was in a Riverfront first time after a long time. I mean, it was nice 3 years ago, but now it's even nicer. So I think that bridge is now open. There's like the bike road, bike track. So then,
By the way, you know what the name of that bridge is?
the name of the bridge, I do have a picture of it. What was it?
The name of is the Senator Margaret Rose Henry Bridge.
There we go. That's your mom's bridge. Hey, so I have a
I
picture.
had to say that. I'm sorry. I had to mention it.
So how did I miss that? Is
Very the lead.
there's always like this. I always say this. I feel like there's always this connection. So like, see now, I met your mom on Tuesday. You are here on a Friday, but then I was there 2 weeks ago.
Right.
That bridge was and I have a picture right on the bridge with my dog. So, and I'm going to show that to you. So then, you know that I'm not. So this is the bridge that we are talking about, right?
It is. Yes, it is. That's it, sir. Yes.
So, and then this is the city view from that bridge.
Great view, isn't it? That's just a great.
So, I mean, last time when I was there, it was kind of still under construction, and that place become like so nice. Like safely, you're able to walk. So many people were out. So many restaurants, hotels. So I think those are all good, but is it enough? And are we there yet? That I don't know. So since you hopefully will be in charge of the county, what are the things that you can do to keep people in Newcastle?
Sure, and I give special kudos to Rob and Chris Buccini, and also Mayor Pizicki, both as mayor and when he served as the head of the Riverfront Development Corporation, for the vision to do all these things, and from the Buccinis and others that made these tremendous investments for this. It's a success story, and I think it has all the elements of what we're talking about to hopefully draw young people, right? But I have to pivot back to what I said earlier about housing affordability, right? You want people to live here and play here and do these things, they got to afford to live here, right? And if they can afford to live here, give them some things that they can do locally, because I know a lot of folks they live in Wilmington, but they go to Philadelphia for their entertainment. They may still do that. Give them a reason to help the local economy with the restaurants, with the nightlife, also especially the arts, right? The arts, the theater, and music, have these things that happen. The county, I know under Matt, and we've done it before, we put a lot of investment in summer programs and events for families. We have the ice cream festival at Rockwood Park, which is near us every year. We have Sleep Under the Stars. We allow outdoor camping at Glasgow Park. We have to do these different types of initiatives to draw people to enjoy the natural features and amenities that we have in Newcastle County and Wilmington as well. But also, we have to remain, I think, the county, and I mentioned before, the state, competitive in bringing in new businesses, right? New opportunities, new blood into the state, into this city, to live here. And we always have to remind ourselves that's not competition, but we got to give people a reason. Why do I want to live in Wilmington? Why do I want to live in Newcastle County? There's a lot of we have great parks, great features, great amenities, and hopefully housing that's affordable and nice. and those job opportunities, they all go hand in hand. I think we're on our way in that area of leisure and entertainment for young. I think they're on a good track there. But as county executive, I want to make sure we incentivize that in other areas, not just Wilmington, but like Old Newcastle or other areas of Newark, where like I was just in Port Penn this week. That's a redevelopment project. Let's incentivize other type of activities and businesses like that all around Newcastle County to draw young people, right?
So I think we're on the right direction. There are good stuff happening. And to be honest with you, I think we also need to go out and see what's happening. So I'm guilty of that. I didn't know it was already so nice out there. And I used to go there more often, but now I'm closer to the city. So I'm able to walk around my neighborhood. So I don't have to, like wintertime when I used to live like right after, before Centerville, I couldn't walk in winter around the neighborhoods because that's right on the 52. But now I'm in a neighborhood that I can, so then I don't need to go somewhere else.
Right.
But then 2 weeks ago, I made a special effort to do it, and that was nice. That was a nice experience. I guess if I was the first timer seeing that, it was welcoming. So I think there are those are really good, important projects. And I think Buccini Group, I don't have any personal ties. I met him a couple times. I think they do, it's business, so we cannot blame them for making money, but commitment to the city of Wilmington and Newcastle County is really important. And I think they're doing a good job and helping everyone. And he was happy that I brought the primary care office to downtown. So he was worried that it was going to be something else. So yeah, he's on board with what we are doing there. Now, our main business office is going to move to 800 Delaware Avenue now. So 600 is our medical office and 800 is going to be our business office where I'm right now is going to move. So it's in the next couple weeks, it's going to be pretty busy now, but you have a busier schedule than we have because you have now. Who's the primary opponents you have? Do you have one or more than one?
I just have one right now. Her name is Karen Hartley Nagel, and she's currently the county council president.
Okay, I think she may be coming, but I don't know if she's confirmed. But we didn't meet her yet. But there's only two of you.
There's two of us right now. I think it's most likely going to end that way. Deadline's coming up in about a month from now.
But you have Margaret Rose Henry on your side, so
I've got a lot of people on my side. I'm feeling good about it.
But your mom by herself is
mom helps. Let me tell you,
half of the state. So that's, I mean, I'm saying not as a politician, but as a person, she's on your side, and that's probably very powerful for you. Anything you would like to add before we close?
No, I just really appreciate this opportunity to talk to you and your audience. I'm very proud to be born and raised in Wilmington and Newcastle County, Delaware. I live here. I chose to live here. I've raised my family here. And this is going to spend the rest of my days here. I'm so fortunate to have this opportunity to also run for public office. Newcastle County is the second largest government in the state of Delaware. We talked about all the important things we do. I just think it's critically important that a person like me with my experience be in that position to move county government forward. Please remember that the election is September 10th, the primary. Please come out to vote. Please be registered to vote, especially as a Democrat, and please support my candidacy. If you want further information, please go to our website at marcushenryde.com. That is marcushenryde.com. Learn more about our platform, how you can volunteer, how you can donate money. All of that's at our website. So thank you.
We'll be sharing those links with this video as well in our social media platforms. And I wish you the best. I know you'll be fine.
Sure.
I'm sure we'll see you again in the next couple months, maybe right before the November elections. So we can maybe bring you back again if you have, if that works out for you as well. But
I have to mention one more thing, just this aside.
Right.
I've been in Istanbul twice in Turkey. I enjoyed it very much. I like your country very much.
Well, we now have an office there, so you are always welcome to join us there.
Let me know when, please. I'll come.
Well, Marcus Henry, thank you so much for joining us.
Really
I'll see you soon.
See you soon. Thank you. Bye-bye.
So, Sean, do you wanna join us?
Yeah.
Nice session. What did you think?
Yeah, I think he's very well spoken. Definitely did his homework and preparation. As you know, he's been campaigning for a while now. He said, I think back in 2022 is when he stepped away from Matt Meyer's actual office to start his own campaign for that position. So he seems to know what he's talking about. Like you mentioned, he's been involved in the field for a number of years now, also as a business owner, specifically healthcare related. It's actually a coincidence, good coincidence in our case for what we do as well. And I think he's prepared for the election. As you mentioned, the other candidate so far, Karen Hartley-Nagel, has not gotten a date confirmed with us. We have reached out a couple times, but haven't heard back officially yet. So I guess that just speaks a little bit towards their campaign and how they're able to balance things and how serious they are taking it. But for Marcus specifically, I think it was definitely a solid session, and I think he has a really good shot. If it's just
So that bridge that I was talking about, that's named after our mom. So that's why I was telling you earlier, she's not just a politician, she's a big legendary name. So that's why probably like there was somehow I was connected to that. I just couldn't remember though. But
subliminal match, yeah.
It's
entering
there
mind,
in
like,
the cloud.
familiarity. Yeah, and then seeing her Tuesday, also another
Right.
coincidence.
So it's like, sometimes things are just connected outside of our control. Now, next week we have Valerie Longhurst, and she was actually also at our event on Tuesday as a panelist. She's busy, and if there are some changes last minute, we understand because she's under a lot of pressure. One of the really important thing that we should mention today is because of the discussions that's happening with the HB 350, with the union discussions for physicians at Christiana Hospital, there's a leadership change. They lost two people, two really important people, and that tells you how much pressure she's probably getting from these people, from this bill. So I'm going to actually tell you the two people who left are their medical group presidents and also their chief medical officer, Roger Gersner, and Lisa Maxwell. So they actually just, I guess they are terminated the way that I understand. And that's why Valerie's probably getting a lot of pressure from everyone. And because what she's doing is making an impact in the healthcare in a good way. So because transparency is the main thing, and that's why we wanted the Newcastle County executives to understand that this is something that is important. So we'll see. We'll have more discussions around that. So based on what's happening next week, we can actually cover some of those. One other thing is now Turkey is planning to join BRICS. So we need to cover that at some point. So the one last thing is Bitcoin is almost hitting the highest ever.
Market's doing pretty well.
It hit 70,000, I believe, earlier this week. That's pretty crazy. But all these changes are showing me that that's going to actually go on the positive traction. So we'll have more discussions later on. We have our Bariatric Friday event with Dr. Irgal in the next 7 minutes. We'll discuss the smoking and alcohol use in the bariatric program and the risk factors of those. So we'll be back in a couple of minutes, and we will see you soon. Bye-bye.
Alrighty, see you guys.